Good morning, friends. I am Dr. Kunal Gupta, consultant medicine in Max Patparganj, East Delhi. In today's session, we will discuss about diabetes, its complication and impact on heart, as well as preventive measures for people with diabetes to prevent heart disease. At present, heart disease remains the leading cause of hospitalization and death in patients with diabetes. Although most have heard of heart disease, few understand what it involves and in turn may not be taking proper steps to reduce the risk of heart disease. Heart disease occurs when blood circulating to the heart is slowed or stopped because of a blockage of artery. Now, what can be the reasons behind this blockage of artery? One of the major risk factors is high sugar level, especially something like it which we see in diabetes. And what does diabetes exactly mean? It is a lifelong disease that affects the body's ability to control blood sugar. In simpler word, it is the condition in which the body has too much glucose in the blood. And why does this happen? So usually when you eat food, the glucose enters the bloodstream. Further, the insulin, which is a hormone, breaks down the glucose from blood into your cells to be stored or used as energy. With diabetes, your body either does not make enough insulin or cannot effectively use the insulin to break this glucose. This leads to high blood sugar level, and what happens is diabetes. Now, did you know diabetes can increase your chance of dying from heart disease? It's true. With diabetes, you are more likely to have a heart attack. And when it comes to diabetes, prevention is very important, as can affect your whole body, right from the feet and especially your heart. In fact, people with diabetes are twice as likely to have a heart attack or stroke as people without diabetes. So it is reported that above 65 years of age, almost 68% of the patients would die from heart disease. Now, the chance of developing heart disease among people with diabetes is not dependent on how well you manage your glucose level. So when we think about diabetes, we should really be thinking about heart disease as well. So even though diabetes sugar management may not be cause of heart disease, but it will definitely reduce the disease risk and the incident. So how does this high sugar level affect the heart? High blood glucose can damage blood vessels, worsen cholesterol levels and make blood pressure more difficult to manage. Persistent high blood glucose leads to diabetes, makes the blood vessels more prone to atheroma. This condition is narrowing of the blood vessels due to collection of bad cholesterol. When the blood vessels narrow, blood flow has trouble reaching different organs of the heart, different organs including the heart, and sudden stoppage of this blood flow to the heart will cause what is called heart attack in a common man's language. So there are a number of risks to lower your risk of heart disease. Understanding the connection between disease and heart disease is the first step towards prevention. Diabetes is commonly referred to as lifestyle disease. Managing diabetes requires patients to make significant and lifelong changes in their lifestyle. These changes require a lifelong commitment from the patient. One can control blood sugar to help lower the risk of heart disease by changing lifestyles such as eating healthy heart food, engaging in physical activity, regular blood glucose monitoring, quitting smoking and relieving stress. Now let us see each of these strategies in detail. So the first is a simple mnemonic A, B, C, the first three alphabets of your alphabets. A for HbA1c, the A1c blood test that measures your average blood sugar level over past 3 months. It is different from blood sugar checks you do each day. You need to know your blood sugar levels on time. The A1c goal for many people with diabetes is below 7. Yet it is better to talk to your physician and decide what is the correct HbA1c level for you. And that should be your target both for diet, exercise and medication. B stands for blood pressure. Blood pressure is the force of your blood against the wall of your blood vessels. If your blood pressure gets too high, it makes your heart work harder. Now the blood pressure goal for most people with diabetes would be less than 140/80. Again, meet your treating doctor to decide what is the correct goal, appropriate goal for you. C would stand for cholesterol, and there are two kinds of cholesterol, HDL and LDL. LDL is the bad cholesterol and it can build up and clog your blood vessels. It can cause heart attack or stroke. HDL on the other hand is the good cholesterol. It removes the bad cholesterol from your blood vessels. So you should know your cholesterol numbers. You should know what is the target for your LDL cholesterol. You should know what is the target for your HDL cholesterol. Again, these are appropriately decided by your treating doctor. If you are over 40 years of age, most of you would require a statin after appropriate consultation, and it is best to use a statin to protect your heart. The second point is eating healthy and a well-balanced diet. There is no one-size-fits-all approach. So you cannot download a chart and decide that this is what I will follow. Eating healthy is important to have a regular pattern and make healthy food choices. Your fat and carbohydrate intake are crucial in managing both your diabetes, your weight, your blood pressure, and keeping your heart healthy. So you have to make simple choices. So the first would be to convert your saturated to unsaturated fat. Having too much saturated fat can increase your blood cholesterol level, especially your bad cholesterol or the LDL levels. So it is important to reduce the amount of saturated fat you eat, and get fats from unsaturated sources. So switch from butter and ghee to unsaturated vegetable oils such as sunflower, olive, corn oils. Trim visible fat from meat and remove the skin from the chicken. Another way to reduce the saturated fat in your diet. Choose lower fat milk and dairy products and change your biscuit, cakes and chocolates for a healthy snack such as fruits. So these are simple ways to convert your saturated fat to unsaturated fat. Remember, fatty foods are also high in calories and excess energy would result in weight gain. So we need to maintain our weight, we need to lower our fat, we need to lower our sugar. To help manage your weight, it is important to keep an eye on the amount of total fat and carbohydrates you take or the amount of total calories you consume. Different fat types have different effects on the body. High saturated fats are linked to higher levels of LDL. So eating unsaturated fat would actually reduce your LDL and improve your good cholesterol, that is the HDL. Third point is eating right. You need to avoid refined wheat breads and cereals, potato chips and fries, red meats, processed meats, saturated fats as we discussed, sugar sweetened beverages, and eat instead of this foods which have more fiber such as whole grain cereals, dairy foods, beans, legumes, lean meats, fish, nuts, healthy oils. Probably olive oil is the best choice, but we saw that even vegetables oils makes a good choice. Choose foods such as fruits, green leafy vegetables, breads and cereals, and low fat or skim milk cheese or preparations out of this skim milk. Another tip is to cut down on your salt. Too much salt is linked with high blood pressure, and we already saw there is a good link between high blood pressure, diabetes and heart. A major risk factor for heart disease is blood pressure. Most of the salt we eat is already there in processed food, so we need not add. Rather, we should check the labels and see which packaged food has the lowest salt content and make a healthier choice by taking those foods which have a lower salt content. So making a healthier choice, reading from the labels is a good way to cut down your salt intake. Another way is to remove the salt shaker from the table. This would stop making you add extra salt in your diet whenever you see the salt shaker. Adding flavor to your food using herbs, black pepper, lemon juice in place of salt when cooking. Eat balanced meals, very important. Eat a reasonable amount of calories to prevent weight gain. Eat regularly at the right time. So those diabetics who are on medication should avoid skipping meals, which may bring the sugar crashing down and lead to hypoglycemia. Eat slowly. This would reduce your peak postprandial glucose and would make the medication easier to handle this load of sugar. Third point is to maintain a healthy weight and engage in regular exercise. Weight loss will improve your cholesterol, your blood pressure and sugar control. And slowly with low intensity, short duration exercise, you can gradually build up with your intensity and time, and your target should be at least 3 times a day either any aerobic exercise, either walking, cycling or swimming. So this also decreases the complication of diabetes, improves your sugar control, improves your blood pressure control, and is good for the heart. Fourth point after your diet and exercise, maintaining good weight, is your medical treatment of diabetes. Take your medication as prescribed by your treating doctor. Do not try to alter it. Always try to go back and consult with him if you feel there is a change in your sugar or you have some doubts. Eat meals and take medications regularly at the right time. Always remember that there is a risk of hypoglycemia if you delay your meal or eat less or if you take regular fasts. Medication must be supported by healthy eating and regular physical activity. So medication, your dietary habits and exercise form a good triad to control your blood sugar, blood pressure and keep your heart healthy. Fifth and most important of this, we should quit smoking and control the amount of alcohol we take. Unfortunately, many people have diabetes and they smoke. And smoking increases not only the risk of diabetes but also the heart. It increases the insulin needs, increases the risk of hypoglycemia. So smoking cessation is an important part of diabetes care. Last but not the least is stress. It is known that stress can increase blood sugar. Try to meditate, do deep breathing exercise, any relaxation technique which can reduce your stress. If you are on medication, please continue to take those medication as regularly as you would take a diabetic medication or a heart medication or a blood pressure medication. Quality sleep is also again a good need for your heart. Try to get at least 7 to 9 hours of sleep daily, and this would reduce the stress on your heart and probably would improve your sugar control. So the bottom line is diabetes can lead to serious medical complication, including heart disease. But you can manage this disease with medication and proper lifestyle changes. And this would avoid the most common complications of diabetes, such as heart. So that would be all from my side. Thank you, dear friends.